Hi, I'm Dr. Miner at Durango Laser Dentistry, and today we're going to talk about women and pregnancy as compared to women that are not pregnant. So when women are pregnant, there's a lot of changes that occur. There's hormones that start to play a role in the body and cause different changes. Some of those cause the joints to become a little more elastic to allow for the birthing of the child when that time comes. And so with these hormones, it also can accentuate certain things. So in the mouth, what we tend to see is the gums can bleed easier. It doesn't take a lot for them to bleed. And with that in mind, if deposits stay on the teeth, the teeth don't get brushed very well, the gums, right, so that deposit that stays on the teeth, the gums can overgrow. And so then afterwards, after the baby's born, the hormones all settle down. Sometimes the gum tissue does not settle down and go back to how it was, and it needs to be trimmed. So that's one thing with good oral health, is to keep those deposits off of the teeth. Brush well and brush frequently. Floss is great. But with pregnant women, right, they may notice when they brush and floss, the gums bleed, and that's part of that is the hormones that are taking place. Just causes the gums to bleed a little easier. And another thing to keep in mind is we often hear we shouldn't have x-rays when they're pregnant. And that is a total myth, right? That dates back to the 40s and 50s. And so nowadays, with how x-rays are taken, they're safe when, safe on the baby, safe on the mom. There's very little radiation exposure, minimal. It just has to be somebody really old school that's actually doing the film that has to be developed, because almost all the x-rays are digital now. And so with the digital x-rays, that makes the radiation a lot lower. It's probably about less than half, probably about maybe 25% of what the normal film x-rays were. And so, checkups are good. Some people avoid checkups while they're pregnant, because they're worried about the x-rays, but again, they're safe, and it's a total myth that they shouldn't have x-rays, while they're pregnant. And because one of the things, if there's a issue going on, it's much better to address it when it's small, rather than wait till it becomes some big issue. Tooth infection, abscess, that kind of thing, especially late in pregnancy, right? Because sometimes procedures can take a long time. So if we have to have the mom tip back, all that weight on the stomach is pretty uncomfortable. If they're 7, 8, almost 9 months along, it can be pretty uncomfortable being back in the chair a long time. And so it's good to be proactive and address things early and have good oral health.